Right. Hello and welcome to our baby yum yummers today. We love talking about everything and educating our parents, especially on everything down there. So we have a very special guest today. We have Dr. Heather Blaylock, who's going to be chatting to us really about vaginal health. I've got a few questions to ask you. So firstly, welcome, doctor. We love having amazing, insightful, and exciting guests joining us on Baby Yum Yum. So I think, can you give me a little bit about yourself, please?
Well, firstly, thank you so much for the invitation. I always love to have opportunities to talk about sex and the clitoris and all the loveliness and the challenges and what we can do to help and make people's lives more pleasurable. So I'm a medical doctor, general practitioner, and I've been working in sexual health for almost 10 years now from a aesthetic medicine background. I'm based in Somerset West, but I travel for my patients to Hermanus and into Cape Town. Yeah, and I'm a mom. I love to be, I'm active. I'm out and about. I don't sit still often unless I'm here at my desk doing my studying.
Amazing. What are you
Yeah.
studying? What are you studying? What are you studying?
I'm studying a diploma in chronic pain management at UCT.
Okay. Wow. All right. Brilliant.
So, in sexual health, we deal a lot with sexual pain.
Okay.
And sexual pain can be very easy to manage, or it can be very complex because it's often very layered and there can be trauma associated.
When you say
And
layered,
so
when you say, doctor, when you say layered and trauma, are you speaking physical layered and trauma or emotional?
both.
Okay. All
Both.
right.
Yeah. And so chronic pain management has also been kind of like revolutionized over the past couple of years in the way that we as medical practitioners approach patients in our history taking, in our management, in our using our colleagues, our physiotherapists, occupational therapists, psychologists, to all help as a team to, for chronic pain, because
Okay.
chronic pain is also complex.
Okay, all right.
Oh.
I mean, and that's going to lend itself to one of my first questions I was going to ask you
Hmm.
is what are you finding in practice? What are the most common challenges regarding women's sexual health? What is like the trend at the moment that people are going through?
So I think that the majority of patients that we see are the perimenopause
Okay.
and postmenopause and the challenges that come with that stage of our lives,
Okay.
which, ranges from physical changes, psychological changes due to all the hormone changes, changes in our bodies, um, and then often we're faced with women who are struggling with low libidos.
Okay.
They may have life changes. So, for example, uh, divorces often happen, during this kind of time as well. New relationships. Yeah, so it's a very broad kind of time in our lives
Mhm.
with lots of challenges. And so the woman presents often actually with low libido, vaginal dryness, pain on intercourse. Um,
And when you
yeah.
say perimenopause, what sort of age does perimenopause start from? I mean, I heard somewhere that someone said the day you hit 40, you're in perimenopause.
In fact, the bad news is that it can even start earlier than that.
Mm-hmm.
So it's really just the change in our estrogen and progesterone levels that starts to decline.
Okay, all right.
And for the woman, it happens pretty gradually. And then there's more of a dip when we're closer to that time. It's very difficult to put into words because the menopause we only diagnose retrospectively. So
Okay,
you're only in menopause if you haven't had a period for a total of 1 year.
okay.
So yeah, the perimenopause can be a very long period of time. It can be 10 years, 15 years. where women experience changes in mood, poor sleep, the night sweats, changes in energy, changes in libido.
And interesting, you know,
You can't really.
I'm obsessed with Victorian history. So, you know, in the Victorian times, when you started going through perimenopause, they would have just thrown you into a lunatic asylum because it would have been like, she's unstable, crazy, go lock her up. And how things have changed,
Exactly.
right?
Yes, thank goodness.
Thank goodness, 100%, absolutely. And are you seeing perimenopause start earlier and earlier and earlier, or is it
Well, we
pretty?
can't, we don't often need to diagnose it or do blood tests to give it a
Yes.
label. And I think sometimes if we also look back and how our patients did present maybe 5 years ago, and we say, oh gosh, she was anxious, and we didn't understand maybe that it wasn't the dog barking at night
Yeah.
or, the little random problem, but it was already that she was experiencing these hormone changes.
Okay. All right.
We mustn't forget as well that premenstrual tension is also really difficult for some women to manage. For some women, it just, comes and goes and passes, and you have maybe like an hour blip. But for other women, it can be very traumatic and very emotional and very physically painful, so it's kind of the same kind of emotions and physical things as the menopause. And also now, because we're living for so much longer, we are living for more time in the menopause, post-menopause now than we did pre-menopause.
Yes.
So if we think about all the psychological and physical changes that are happening to us at that time, we have to now live with and adjust to and accommodate those changes, for 30 years now.
Absolutely. And are the developments and the advancements, they're obviously better than what they were from a treatment point of view. And as you said, you have a multidisciplinary team that obviously you would get involved with that. I mean, I know that this topic isn't necessarily about menopause and perimenopause and postmenopause, but that is definitely something that needs to be highlighted. It is something that happens in women's lives. So I think, am I right in saying that if you are going through menopause, there is help for you?
Absolutely, yes. There is help.
And is it just medicinal, or is there other things that
No, so there are a variety of ways that we can manage patients.
Okay.
Natural medicine combinations thereof, therapy. We've got a great basket of things to offer our ladies, and nobody should be struggling through this phase.
Okay, all right. I think that gives a lot of people hope. I think that's great. But I want to start all the way back at the beginning. Let's talk about vaginal cleaning and health. Now, the vagina, does it have its own like scrubbing system in it with like windscreen wipers and sponges? Do we need to really get down there, in and out and clean? What's the story down there?
Oh my gosh, I'm having a vision now of a bottle brush being like up and down the vag. Okay, so firstly, just to distinguish anatomically, in case some of the listeners are not aware, the vagina is an internal organ, an internal muscular organ that you cannot see from the outside. So you can see the entrance, so what we call the introitus. But the genitalia of a female on the outside, what we see is called the vulva. Okay. So now the vagina is a muscular tube that expands to accommodate a penis, for example, or during natural childbirth, the head and the body of a baby. And then, so it's like a concertina. So it expands to accommodate, and then it goes back to its original resting state. It operates at a very specific pH. If anything interrupts that pH, then things can start to go wrong. So our whole body is covered in various bacteria and fungi and little parasites normally that we don't see, but they keep us in homeostasis. So now the vagina is the same. We've got bacteria that live there that keep that area happy and in homeostasis and functioning at that pH. Now, the moment we start interfering with that, with douching, anything that's fragranced, even semen can interrupt it, using toys, using lube with also with fragrances or colorants, etc., and can all interrupt that pH balance, and then bad bacteria can come and take over and cause other problems. So when you're talking about washing the vagina doesn't need washing.
Okay, yeah. The vulva.
Okay. So the vulva, yes. So we can, if you just wash it like you wash the rest of your body, you know, you don't need special products. You just need normal mild soap and water.
Okay, all right. And what about, I mean, we spoke about special washes and stuff like that. So you do get washes that say that optimal pH balance and all those sort of things. Why would we use that if they don't really help? Or do they help in the case where the pH is completely out?
Yeah, so the pH is completely out. You're going to probably present to your doctor with a bacterial vaginosis.
Okay.
Where you would notice because there's a different smell.
Okay. Or a discharge.
Okay, so they are female products. And if they are neutral products with no fragrances and no colorants, etc., and the pH is correct, then by all means use them. Because I think we pay so much attention to, for example, our faces, the way we look, and regenerating our skin and our face, and for pumping it up and keeping it hydrated. We should also be paying our genitalia that same amount of attention with the right products, if necessary. You know, so if somebody feels good by using those products, then by all means use it, you know, and we should, because our sexuality is so much related as to how we feel about ourselves internally and externally, and our sexuality is really how we present ourselves to the world. So I do think, coming from an aesthetic background as well, that we should be also taking care of our vulva and vaginal area.
Absolutely. I mean, it's like if you wear nice underwear, you feel nice, you know. So it's about looking after the whole of you. Absolutely.
Yes, absolutely.
So let's talk about vaginal let's talk about vaginal rejuvenation or vaginal plasty, or whatever you want to call it. I love this. I want to hear more about it, because, you know, you hear all of these things: have a Caesar, save the beaver, those kind of things. But now there's something different that people can do. So tell me about it. How does it work? What do we do? What are the end results?
Okay, so firstly, vaginal rejuvenation, we have non-surgical and surgical. So surgical will involve something like your labiaplasties, or fat filling into the mons pubis and the labia majora. And that should be done by a plastic surgeon or a urogyne, or somebody who's got a lot of experience in that area because of the risks of infection, etc., etc. The non-surgical rejuvenation things that we have available to us can also be internal vaginal or external vulval. Okay. So if we're talking about external, we can do filler enhancement of the labia majora and the mons pubis. We can do pigment laser treatments.
Oh, wow. Okay.
We can do radio frequency and or laser external treatments for tightness and pigmentation, etc.
Mm-mm-mm.
Um, internally,
How successful are those things? I mean, is there a huge difference that you see, or is it a subtle difference that only you would really know?
so it is a subtle difference, but it's the same, if we compare doing these treatments on our face and doing them on our genitalia, it's really, if we're putting filler in our face, if we put 1 mil in, you're going to have a subtle difference. If you can afford to
Absolutely.
put 10 mils in, you're going to
Yeah.
have a big difference.
Okay.
It's the same if you're going to do a facelift, you can obviously pull much tighter than if you try to do a lift with other aesthetic products.
Absolutely.
So then we have the internal laser treatments. So they can either be done with a radio frequency machine or a laser machine. They basically do the same thing internally. They're just delivering the heat energy in a different way. So what this does internally is it can stimulate our own cells to regenerate and to make more cells. So it can help a little bit with like lubrication issues in the postmenopause. So what happens in the perimenopause, menopause, postmenopause is that the tissue becomes thin.
Okay.
It becomes thin, it becomes less pliable, less muscular, what we call atrophic. So the color can change. It can be more prone to injury, etc., because of thin.
So it's like a
So
tree that hasn't been watered, right?
yeah,
Yeah.
yeah, something like that. Yeah. And so the laser and the internal radio frequency treatments can it increases tissue health really and can
Okay.
help those with those issues and can help with a little bit of tightness. So you get some women who have the treatments and they say they don't really feel a difference. And then other women have the treatments and they say, oh my gosh, my husband asked me to stop because, I feel like it's too tight.
Okay.
So
Yeah.
they're not one-off treatments.
Yeah.
It's a series of treatments over a period of time. It's very dependent on what the woman wants. So it's quite important at the beginning to establish what her desires are and what the expected outcomes are, because
Okay.
sometimes expectations can be, can be non-attainable.
But I suppose also,
It's
in your sort of case where you're working with a multidisciplinary team, if you find that something is not going to be obtainable by doing whatever treatment, you can obviously then refer to someone else in your team that can assist with something that needs to be potentially fixed in
yeah.
another sort of way.
And also we can often identify women who have body dysmorphic
Okay.
syndrome or tendencies. And, we've got to, are they watching porn? Are they watching these beautiful Barbie women with
Unrealistic.
bodies only 0.0001% of the world has, that it's,
Oh,
that's all got background lighting, etc. We don't want them to be trying to do something physical to feel better if there's something deeper that's causing the distress.
Okay, that makes a lot of sense. And
Yeah.
I think that's amazing that you would pick that up and you would actually work with that as opposed to just doing the job because it's an income source. I think that's
No,
great
because you
model.
can get into a lot of problem, you can get into further trouble with that because everything has potential side effects and they're medical procedures. The
Okay.
other procedure we can do, which involves needles as well, is the platelet-rich plasma, so the PRP.
Mm.
You may have heard of the vampire facial.
Yes.
Okay, so it's basically, we can do the same in the vaginal area.
That's what they take out your
So
blood, spin it around, and put it back in. Am I
yes,
right? Okay.
that's right. Yeah. So we take the rich layer, it separates into different layers in the test tube, and we take the layer that's rich in stem cells
Yeah.
and growth factors, and then we can inject it back. So we can inject it back anywhere into the tissue, including the clitoris. So that
Okay.
is where you would have heard of people talk about the orgasm shot or the O shot.
Yes.
So I want to just stress that this procedure is not for women who have orgasm problems and are orgasmic. It's not a treatment. It is really for women who want to experience heightened pleasure, heightened orgasms. So we inject PRP into the clitoral area and also onto the area of the vagina, the anterior third. So where we would talk about people having the G spot, that would be the most commonly experienced, most pleasurable part of the vaginal area. So it's the anterior lower third.
Okay. And is that a repetitive treatment or is it a one-off thing?
So it can be just a one-off, but often women will come back for that. So it's also a regenerative, part of regenerative medicine, which means that we are stimulating our own body to produce more collagen, more elastin, more healthy tissue, etc.
And my next question is, what is the secret to sexual health? Like, how do you keep that like sexual flame alive, essentially? Is it a mental thing? Is it a couple's guidance? Is it aesthetics? What is it? What do you feel what have you come across and what do you feel works the best?
Okay, so all new relationships are full of rainbows and unicorns and fireworks and
butterflies and
when you're a new couple, heterosexual, homosexual, it can be very sexually powered. There's a lot of fire, a lot of passion. You can't keep your hands off each other. You're having sex everywhere, all the time. And then over time, when your relationship is more established, that does tend to become less and less and less. And I do have to also stress that getting married can change that quite significantly. So first, moving in together has an impact. Then getting married, so the big white dress and your big happy day can immediately change the number of times you're having sex. It seems bizarre.
Why?
But
is it
does.
psychological? What is it? Or is it like someone just turns off a switch?
That's like somebody just turns off a switch. And then obviously, then you introduce different kinds of stresses. So now you're living together, you have to have domestic chores, you have to split chores, you have financial concerns, you've got to talk about money. Then you're going to introduce a new baby into the home or a pet, for example, where there's also added stresses. Your attention is shifted away from your partner and shifted onto a new baby or shifted onto a puppy. So all of those just life things added into a relationship. If you're not paying attention to your sexual relationship and you're not giving it the time, then it can sometimes be put to a side. Also, couples very quickly can get into a routine. So you can learn very quickly sexually what your partner likes, and they can work out pretty quickly what you like and gets you off. And so what happens is you engage in a sexual interaction and you go A, B, C, wham, bam, finished. So boredom can then creep into your sexual relationship. And so for a couple, it is so important to be constantly coming back to each other and communicating. We're going to talk about finances. We're going to talk about where we want to go on holiday. You've also got to put sex into that equation. And then communication is key to have a healthy sexual relationship. If you can't tell your partner what you want or what you like, they are going to take a long time. So you should also be able to say to your partner, hey, man, it's been like 3 weeks and we haven't connected sexually. What's happening? Let's get together. Let's spice it up. And so if couples are mature enough to acknowledge the boredom, to acknowledge that time between sexual engagements is getting longer and longer and longer,
Mhm.
then you're more than halfway there. If you can communicate with your partner, you are like way further than most couples. And if you can then communicate, can you then introduce a little bit of excitement, change the place where you have sex, have date nights, go away for a night, go away for a weekend, dress up, do role play. It doesn't have to be seriously off the wall, kinky, it can just be something,
Change.
a change. That's it, a change.
And you spoke about women entering the perimenopause phase, whatever,
Mhm.
you've been in your marriage for a long time, you've got kids, whatever, blah, blah, blah. Is it too late in a marriage to try and find that sexual spark again at that stage?
Absolutely not. Absolutely not. It's couple dependent,
Mm.
and they've both got to be on the same page.
Okay.
But let's not forget that we now also recognize the andropause. Okay, so the andropause is when men start to experience symptoms of their testosterone falling.
Okay.
So now, even from the age of 35, men's testosterone levels start to drop. It's not as pronounced as women and the menopause,
Mm-hmm.
but they can experience what looks like a depression.
Okay.
So low energy, low mood, low libido. Maybe they're experiencing poor erections. And then what men tend to do is they start to withdraw,
Okay.
or they become confrontational and, for example, start a fight so that they can't have a sexual interaction because they're embarrassed about their erectile function.
Okay. All right.
So if men are experiencing erectile difficulties, they also sometimes feel inadequate,
Mm. It's an ego. It's
embarrassed.
an ego. It's an
Yes,
ego
ego.
issue. Yeah.
Men are always supposed to be like up for it. They're always supposed to be hard, blah, blah, blah. Also from watching porn, there's that expectation of what they see
Mm.
on porn. They
Mm.
feel like they're letting their partner down. So, there can be issues at this age. I'm talking about this age with me because I'm in my 50s and, can relate very well to those changes.
Mm. Mm. Mm.
To get both partners on the same page, open communication, and to look at both of their concerns, because at the age of 50, men are also sitting with issues,
Absolutely.
sexual issues.
Absolutely. Absolutely. Tell me about, all of the aesthetic sort of treatments. Pricey, not pricey. What are we talking about here?
Gosh, so I can't really give you prices off the top of my head. And also, you will find that many doctors charge very different
Of
prices.
course, absolutely. Absolutely.
So, there is a range. Obviously, filler product is expensive.
Yeah.
Um,
But like you can't claim back
Botox is
from medical aid
expensive.
wouldn't contribute to any of this, right?
No,
Which is very
no,
sad because often those aesthetic changes change your entire mental well-being. And
absolutely.
it's the one
Absolutely.
goes hand in hand with the other. And it's a pity that they don't.
Well, if you just look at, for example, breast reduction surgery.
Yes,
So breast reduction surgery can save the medical aids thousands and thousands of rands if the woman at a young age were just able to go through that process of having the reduction,
absolutely.
physical challenges, physiotherapy visits, days off work.
There's just so much.
psychologist. Right? It's so much.
Absolutely, absolutely. Again, it's looking at the root of the problem as opposed. I
Yeah.
quite agree with you, 100%. Yeah, like
And
wait
that
medical
is why
aid.
I talk, yeah, and that is why talking about sexual health is so phenomenal when we get given a platform, on radio or wherever
Mm,
to talk about it, because so many people don't realize that they are not unique, and that there is help, and that there is help on a series of different levels that doesn't have to stretch your budget.
mm.
So, for example, in the perimenopause and premenstrual, we know that we need more magnesium, zinc, and certain of the vitamin Bs.
Okay.
Okay. So now most of us are taking multivitamins anyway.
Mm,
But if the women who are struggling with PMS and
mm,
struggling with the perimenopause, with moods and not sleeping, for example,
mm, mm.
just having the correct doses of vitamin Bs. So, there's a whole lot of them. So
Yeah.
there's specific ones like 3, 5, 6, and
Well,
12.
yeah.
And then magnesium, for example, that helps with sleep and pain control.
Mm, mm,
Those are
mm.
simple things that we're probably doing anyway. Let's just do them in the right doses.
Absolutely. And focus on specific things as opposed to
And
just,
then exercise.
yes.
So moving, we've got to move. We know that women who exercise on a regular basis experience less PMS,
Mm,
pain, and mood changes.
okay.
And the same with the perimenopause and the postmenopause.
Okay. So, I mean, even if it's just walking every day, I mean, walking, I think, is the most
Exactly.
wonderful thing ever. It's great for your mind, it's great for your body. As you said, it's got so many
Exactly.
amazing
Yeah. So
benefits
we
behind it.
have to keep moving.
Absolutely. Yeah. And that doesn't entail moving from your bed to the kitchen. That's like, no, we've got to do
No, no,
more
no, no,
than that. Much
no.
more than that. Doctor, I've got 5 minutes left with you, so I'm going to wrap up.
Oh,
But what I want to ask you is also, if people, I think a lot of people are embarrassed, like, I want to do something with my vagina, but I'm too scared to go talk to somebody. How do you find a reliable and professional and someone who can actually do all of these treatments with you? Do we just Google, like, make my vagina look nicer, doctor? Or how do we find someone like as yourself and Dr. Novakova? How do we find you?
gosh, that's really hard. I think a lot of our work comes from word of mouth,
Yeah.
but from the sexual health point of view, we do have a big team called My Sexual Health.
Mm-hmm.
I'm sure you must have heard of them. We have a website where you can find listed medical doctors in your area and or pelvic floor physiotherapists,
Mm-hmm.
occupational therapists, and sexologists, psychologists who work in your area. A lot of us do online consultations. Yeah, so I think that's probably the best way in South Africa to find us,
And
because not
how do we get
yeah.
directly to you though also? So how do we get directly to the practice in which you are? So we want to make an appointment with you. How do we get hold of you? Do you have Instagram, website, email? How do we get
But
hold of
yes,
you?
so I've got Instagram, Dr. Heather Blaylock. I'm busy putting up my webpage for the Hermanus practice and also for Dr. Novikova's practice.
Mhm.
Or you can reach me through the My Sexual Health platform, and the receptionist will direct the patients.
Okay, amazing, fantastic. And do we have to wait months to get an appointment to see you? Are we going to lose interest by the time we finally get to see you?
No, you're not.
Okay, that's so good. That's like so great. I love that. You see, you're so holistic. You're taking care of our every need. We absolutely love that. Anything in closing, really, that you just want to say to our followers, who obviously are particularly women, but obviously there are a few men as well. And we have a whole range of women, from people who are pregnant all the way through to grannies, through to educate a lot of people across the spectrum. What do you want to close with and give them some like words of advice?
I was thinking yesterday, sex is such a natural thing,
Mm-hmm.
okay? And it's such a beautiful potential experience. It's like sex needs to be let out the closet.
Mm-hmm.
So at the moment, we've got all our beige suits
Yeah.
closed in a closet. And we want to be able to open the closet and let
Yeah.
all the sequins and the sparkles out.
Love it. Love it.
So, so sex is so natural and so normal, and our genitalia is part of our humanness. I don't understand why we don't talk more about it when it can have such an impact in a
Absolutely.
positive or a negative way. And we should
Absolutely.
embrace it. We
I
should
was
not
just
shy
going to
away
say
from it.
that. I was just going to say that it's about
Mm,
embracing it and loving
exactly.
every single part of our body, even that tiny
Yes.
little clitoris down there. It's so important to, I completely agree with you. So I think it's
Yeah.
awesome for people to know that there are things that can be done, whether from a mental perspective or from an
Mm,
aesthetic perspective, and that there's modern technology out there. There's really clever people out there like you. Like we need to use what we can get the best resources to give us the best of what we can experience sexually. So I'm going to say thank you very, very much to you. And I'm sure we're going to have lots of questions, but we're just going to fly them off to you if we do get them via email, so you can answer them for us. But thank you very much for your time. And thank you for
oh, you're most welcome. Thank
liberating
you.
women. Thank you for liberating women and opening the conversation.
Open the
Absolutely.
closet. Wear the
Yes, I
sparkles.
love that. I love it.
Wear the heels.
And the heels, 100%. So
Yes.
thank you for your time and continue just embracing it and yeah, we'll keep pushing it from our side as well. But as I said, I'm sure anyone's got questions, we're just going to fire them off to you. But thank you so much for your time and yeah, go and have great sex.
Amen.
Amen to that one. Thanks, Heather.
Right.
Thank you
Thank
so much.
you.
Thank you. Bye. Bye.